Hey, Alpha Nurses, I'm Licensure from alphanurseguy.com. This is 120 practice questions. Without the way, let's get started.
Which assessment data would indicate to the nurse that the client would be at risk for a hemorrhagic stroke? 1. A blood glucose level of 480 milligrams per deciliter. 2. A right-sided carotid brute. 3. A blood pressure of 220 over 120. 4. The presence of bronchogenic carcinoma. The correct answer is 3. A blood pressure of 220 over 120. Uncontrolled hypertension is a risk factor for hemorrhagic stroke, which is a ruptured blood vessel inside the cranium. A 78-year-old client is admitted to the emergency department with numbness and weakness of the left arm and slurred speech. Which nursing intervention is priority? 1. Prepare to administer recombinant tissue plasminogen activator. 2. Discuss the precipitating factors that cause the symptoms. 3. Schedule for a stat computed tomography scan of the head. 4. Notify the speech pathologist for an emergency consult. The correct answer is 3. Schedule for a stat computed tomography scan of the head. A CT scan will determine if the client is having a stroke or has a brain tumor or another neurological disorder. If a CVA is diagnosed, the CT scan can determine if it is a hemorrhagic or ischemic accident and guide treatment. The nurse is caring for the following clients. Which client would the nurse assess first after receiving the shift report? 1. The 22-year-old male client diagnosed with a concussion who is complaining someone is waking him up every 2 hours. 2. The 36-year-old female client admitted with complaints of left-sided weakness who is scheduled for a magnetic resonance imaging scan. 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. 4. The 62-year-old client diagnosed with a cerebrovascular accident who has expressive aphasia. The correct answer is 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. The Glasgow Coma Scale is used to determine a client's response to stimuli, eye-opening response, best verbal response, and best motor response, secondary to a neurological problem. Scores range from 3 to 15. The client with a seizure disorder is prescribed fosphenytoin. Which interventions should the nurse discuss with the client? Select all that apply. 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. 3. Encourage the client to decrease drinking of any type of alcohol. 4. Discuss the importance of maintaining good oral hygiene. 5. Explain the importance of maintaining adequate nutritional intake. The correct answers are 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. And 5. Explain the importance of maintaining adequate nutritional intake. The client should wear a medic alert bracelet and carry identification so that an HCP and others possibly providing care know that the client has a seizure disorder. The client should not take any OTC medications without first consulting with the HCP or pharmacist because many medications interact with fosphenytoin, an anticonvulsant. The medication may cause anorexia, nausea, and vomiting. Therefore, the client should maintain an adequate nutritional intake. The nurse is assessing a client experiencing motor loss as a result of a left-sided cerebrovascular accident. Which clinical manifestations would the nurse document? 1. Hemiparesis of the client's left arm and apraxia. 2. Paralysis of the right side of the body and ataxia. 3. Homonymous hemianopsia and diplopia. 4. Impulsive behavior and hostility toward family. The correct answer is 2. Paralysis of the right side of the body and ataxia. The most common motor dysfunction of a CVA is paralysis of one side of the body, hemiplegia. In this case, with a left-sided CVA, the paralysis would affect the right side. Ataxia is an impaired ability to coordinate movement. The client with increased intracranial pressure is receiving mannitol. Which data would cause the nurse to hold the administration of this medication? 1. The serum osmolality is 330 milliosmoles per kilogram. 2. The urine osmolality is 550 milliosmoles per kilogram. 3. The blood urea nitrogen level is 8 milligrams per deciliter. 4. The creatinine level is 1.8 milligrams per deciliter. The correct answer is 1. The serum osmolality is 330 milliosmoles per kilogram. The normal serum osmolality is 275 to 300 milliosmoles per kilogram. The osmotic diuretic mannitol is held if the serum osmolality exceeds 310 to 320 milliosmoles per kilogram. The nurse is preparing to administer the following anticonvulsant medications. Which medication should the nurse question administering? 1. Carbamazepine to the client, who has a carbamazepine serum level of 8 micrograms per milliliter. 2. Clonazepam to the client, who has a clonazepam serum level of 60 nanograms per milliliter. 3. Phenytoin to the client, who has a phenytoin serum level of 26 micrograms per milliliter. 4. Ethosuximide to the client, who has an ethosuximide serum level of 45 micrograms per milliliter. The correct answer is 3. Phenytoin to the client, who has a phenytoin serum level of 26 micrograms per milliliter. The therapeutic serum level of phenytoin, an anticonvulsant, is 10 to 20 micrograms per milliliter. Because the client's level is above that range, the nurse should question administering this medication. Which client would the nurse identify as being most at risk for experiencing a CVA? 1. A 55-year-old African American male. 2. An 84-year-old Japanese female. 3. A 67-year-old Caucasian male. 4. A 39-year-old pregnant female. The correct answer is 1. A 55-year-old African American male. African Americans have twice the rate of CVAs as Caucasians, and men have a higher incidence than women. African Americans suffer more extensive damage from a CVA than do people of other cultural groups. The client with a head injury is experiencing increased intracranial pressure. The neurosurgeon prescribes mannitol. Which intervention should the nurse implement when administering this medication? 1. Monitor the client's arterial blood gases during administration. 2. Do not administer if the client's blood pressure is less than 90/60. 3. Ensure that the client's cardiac status is monitored by telemetry. 4. Use a filter needle when administering the medication. The correct answer is 4. Use a filter needle when administering the medication. The nurse must use a filter needle when administering the osmotic diuretic mannitol because crystals may form in the solution and syringe and be inadvertently injected into the client if a filter needle is not used. Which data should the nurse assess for the client with a seizure disorder who is taking Valproate? 1. Creatinine and blood urea nitrogen levels. 2. White blood cell count. 3. Liver enzymes. 4. Red blood cell count. The correct answer is 3. Liver enzymes. Hepatotoxicity is one of the possible adverse reactions to Valproate, an anticonvulsant. Therefore, the liver enzymes should be monitored. The client diagnosed with a right-sided cerebrovascular accident is admitted to the rehabilitation unit. Which interventions should be included in the nursing care plan? Select all that apply. 1. Position the client to prevent shoulder adduction. 2. Turn and reposition the client every shift. 3. Encourage the client to move the affected side. 4. Perform quadriceps exercises 3 times a day. 5. Instruct the client to hold the fingers in a fist. The correct answers are 1. Position the client to prevent shoulder adduction, and 3. Encourage the client to move the affected side. Placing a small pillow under the shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. The client should not ignore the paralyzed side, and the nurse must encourage the client to move it as much as possible. A written schedule may assist the client in exercising. The client with a seizure disorder who is taking carbamazepine tells the clinic nurse, "I am taking evening primrose oil for my premenstrual cramps, and it is really working. Which statement is the nurse's best response? 1. You should inform your HCP about taking this herb. 2. It is very dangerous to take both the herb and carbamazepine. 3. Herbs are natural substances, and I am glad it is helping your PMS. 4. Are you sure you should be taking herbs along with carbamazepine? The correct answer is 1. You should inform your HCP about taking this herb. Evening primrose oil may lower the seizure threshold, and the dose of carbamazepine, an anticonvulsant, may need to be modified. Therefore, the client should notify the HCP. The nurse is planning care for a client experiencing agnosia secondary to a cerebrovascular accident. Which collaborative intervention will be included in the plan of care? 1. Observe the client swallowing for possible aspiration. 2. Position the client in a semi-Fowler's position when sleeping. 3. Place a suction setup at the client's bedside during meals. 4. Refer the client to an occupational therapist for evaluation. The correct answer is 4. Refer the client to an occupational therapist for evaluation. A collaborative intervention is an intervention in which another healthcare discipline, in this case, occupational therapy, is used in the care of the client. The client with a seizure disorder is prescribed phenytoin. Which statement indicates the client understands the medication teaching? 1. If my urine turns a reddish-brown color, I should call my doctor. 2. I should take my medication on an empty stomach. 3. I will use a soft bristled toothbrush to brush my teeth. 4. I may get a sore throat when taking this medication. The correct answer is 3. I will use a soft bristled toothbrush to brush my teeth. The client should use a soft bristled toothbrush to prevent gum irritation and bleeding. Gingival hyperplasia is a side effect of this medication. The nurse and an unlicensed assistive personnel are caring for a client with right-sided paralysis. Which action by the UAP requires the nurse to intervene? 1. The assistant places a gait belt around the client's waist prior to ambulating. 2. The assistant places the client on the back with the client's head to the side. 3. The assistant places a hand under the client's right axilla to move up in bed. 4. The assistant praises the client for attempting to perform ADLs independently. The correct answer is 3. The assistant places a hand under the client's right axilla to move up in bed. This action is inappropriate and would require intervention by the nurse because pulling on a flaccid shoulder joint could cause shoulder dislocation. The client should be pulled up by placing the arm underneath the back or using a lift sheet. The client has increased intracranial pressure, and the HCP orders a bolus of 0.5 grams per kilograms IV of 25% osmotic diuretic solution. The client weighs 165 pounds. How much medication should the nurse administer to the client? The correct answer is 37.5 grams. To determine this, first find the client's weight in kilograms. 165 pounds divided by 2.2, which equals to 75 kilograms. Then, multiply 0.5 grams by weight in kilograms. 0.5 multiplied by 75 kilograms, which equals to 37.5 grams. The client diagnosed with atrial fibrillation has experienced a transient ischemic attack, TIA. Which medication would the nurse anticipate being ordered for the client on discharge? 1. An oral anticoagulant medication. 2. A beta blocker medication. 3. An anti-hyperuricemic medication. 4. A thrombolytic medication. The correct answer is 1. An oral anticoagulant medication. The nurse would anticipate an oral anticoagulant, warfarin, to be prescribed to help prevent thrombi formation in the atria secondary to atrial fibrillation. The thrombi can become embolic and may cause a TIA or CVA. The client with increased intracranial pressure is receiving mannitol. Which intervention should the nurse implement to evaluate the effectiveness of the medication? 1. Monitor the client's vital signs. 2. Maintain strict intake and output. 3. Assess the client's neurological status. 4. Check the client's serum osmolality level. The correct answer is 3. Assess the client's neurological status. Mannitol, an osmotic diuretic, is administered to decrease intracranial pressure. Changes in intracranial pressure affect neurological status. Therefore, the client's neurological status should be evaluated to determine the effectiveness of the medication. The client has been diagnosed with a cerebrovascular accident, stroke. The client's wife is concerned about her husband's generalized weakness. Which home modification should the nurse suggest to the wife prior to discharge? 1. Obtain a rubber mat to place under the dinner plate. 2. Purchase a long-handled bath sponge for showering. 3. Purchase clothes with Velcro closure devices. 4. Obtain a raised toilet seat for the client's bathroom. The correct answer is 4. Obtain a raised toilet seat for the client's bathroom. Raising the toilet seat is modifying the home and addresses the client's weakness in being able to sit down and get up without straining muscles or requiring lifting assistance from the wife. The client with a head injury is admitted into the intensive care unit. Which HCP medication order should the ICU nurse question? Select all that apply. 1. Morphine. 2. Mannitol. 3. Methylprednisolone. 4. Phenytoin. 5. Oxygen. The correct answers are 1. Morphine and 3. Methylprednisolone. Administering narcotics to clients with head injuries may mask signs of increased intracranial pressure, so the nurse questioning this medication would be appropriate. Research supports the finding that clients with head injuries who are treated with anti-inflammatory corticosteroids are 20% more likely to die within 2 weeks after the head injury than those who aren't treated. The nurse should question this medication. The client is diagnosed with expressive aphasia. Which psychosocial client problem would the nurse include in the plan of care? 1. Potential for injury. 2. Powerlessness. 3. Disturbed thought processes. 4. Sexual dysfunction. The correct answer is 2. Powerlessness. Expressive aphasia means that the client cannot communicate thoughts, but understands what is being communicated. This leads to frustration, anger, depression, and the inability to verbalize needs, which, in turn, causes the client to have a lack of control and feel powerless. The nurse is preparing to administer medications to the following clients. Which medication should the nurse question administering? 1. Furosemide to a client with a serum potassium level of 4.2 milliequivalents per liter. 2. Mannitol to a client with a serum osmolality of 280 milliosmol per kilogram. 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. 4. Phenytoin to a client with a phenytoin level of 14 microgram per milliliter. The correct answer is 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. The normal digoxin level is 0.8 to 2.0 nanograms per milliliter. A digoxin level of 2.4 nanograms per milliliter would warrant the nurse questioning the administration of this medication. The trade name for digoxin is Lanoxin, and the classification is cardiac glycoside. The 85-year-old client diagnosed with a stroke is complaining of a severe headache. Which intervention should the nurse implement first? 1. Administer a non-narcotic analgesic. 2. Prepare for stat magnetic resonance imaging. 3. Start an intravenous infusion with D5W at 100 milliliters per hour. 4. Complete a neurological assessment. The correct answer is 4. Complete a neurological assessment. The nurse must complete a neurological assessment to help determine the cause of the headache before taking any further action. The client with a head injury is ordered a CT scan of the head with contrast dye. Which statements by the client warrant immediate intervention? Select all that apply. 1. I take atenolol for my high blood pressure. 2. I am allergic to many types of fish. 3. I get nauseated whenever I take aspirin. 4. I am taking metformin for my diabetes. 5. I had about 3 beers before I fell and hit my head. The correct answers are 2. I am allergic to many types of fish, And 4. I am taking metformin for my diabetes. The contrast dye used in a CT scan is iodine-based, and an allergy to shellfish suggests an allergy to iodine and would warrant the nurse notifying the HCP to cancel the contrast part of the CT scan. Further assessment would be needed. Metformin, a biguanide medication used for control of diabetes, must not be taken because the kidneys remove metformin. Contrast medium can greatly increase the level of metformin in the blood because damaged kidneys are not as effective at removing metformin from the body. A client diagnosed with a subarachnoid hemorrhage has undergone a craniotomy for repair of a ruptured aneurysm. Which intervention will the intensive care nurse implement? 1. Administer a stool softener, BID. 2. Encourage the client to cough hourly. 3. Monitor neurological status every shift. 4. Maintain the dopamine drip to keep blood pressure at 160/90. The correct answer is 1. Administer a stool softener, BID. The client is at risk for increased intracranial pressure whenever performing the Valsalva maneuver, which will occur when straining during defecation. Therefore, stool softeners would be appropriate. The client has an open laceration on the right temporal lobe secondary to being hit on the head with a baseball bat. The emergency department's HCP sutures the laceration, and the CT scan is negative. Which instruction should the nurse discuss with the client? 1. Do not put anything on the laceration for 72 hours. 2. Use hydrocortisone cream 0.5% on the laceration. 3. Cleanse the area with alcohol 3 times a day. 4. Apply a topical antibiotic ointment to the sutured area. The correct answer is 4. Apply a topical antibiotic ointment to the sutured area. The sutured area must be cleansed with soap and water and patted dry, and an antibiotic ointment, such as Neosporin, should be applied to prevent infection. The client diagnosed with a mild concussion is being discharged from the emergency department. Which discharge instruction should the nurse teach the client's significant other? 1. Awaken the client every 2 hours. 2. Monitor for increased intracranial pressure. 3. Observe frequently for hypervigilance. 4. Offer the client food every 3 to 4 hours. The correct answer is 1. Awaken the client every 2 hours. Awakening the client every 2 hours allows the identification of headache, dizziness, lethargy, irritability, and anxiety, all signs of post-concussion syndrome that would warrant the significant others taking the client back to the emergency department. The following clients have a head injury. Which clients should the nurse question administering the medication mannitol? Select all that apply. 1. The 34-year-old client who is HIV positive. 2. The 84-year-old client who has glaucoma. 3. The 68-year-old client who has cor pulmonale. 4. The 16-year-old client who has cystic fibrosis. 5. The 58-year-old client with congestive heart failure. The correct answers are 3. The 68-year-old client who has cor pulmonale, and 5. The 58-year-old client with congestive heart failure. Cor pulmonale is right-sided heart failure, often secondary to chronic obstructive pulmonary disease. Because mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the heart with right-sided failure could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. Because the osmotic diuretic mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the client in CHF could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. The resident in a long-term care facility fell during the previous shift and has a laceration in the occipital area that has been closed with steri-strips. Which signs/symptoms would warrant transferring the resident to the emergency department? 1. A 4 centimeters area of bright red drainage on the dressing. 2. A weak pulse, shallow respirations, and cool, pale skin. 3. Pupils that are equal, react to light, and accommodate. 4. Complaints of a headache that resolves with medication. The correct answer is 2. a weak pulse, shallow respirations, and cool, pale skin. These signs, symptoms, weak pulse, shallow respirations, cool, pale skin, indicate increased intracranial pressure from cerebral edema secondary to the fall, and they require immediate attention. Which discharge instructions should the emergency room nurse discuss with the client who has sustained a concussion? Select all that apply. 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. 3. If experiencing a headache, take 1 hydrocodone every 8 hours. 4. It is all right to take a couple of aspirin if experiencing a headache. 5. Notify the HCP if the medication does not relieve your headache. The correct answers are 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. And 5. Notify the HCP if the medication does not relieve your headache. Traumatic brain injuries can impair many brain functions that can be significantly worsened by alcohol, so the client should not drink alcoholic beverages until allowed by the HCP. Acetaminophen, a non-narcotic analgesic, can be taken for a headache in a patient who has sustained a concussion. If acetaminophen does not relieve the client's headache, then the client should notify the HCP because this may indicate a worsening condition, such as increased intracranial pressure. A school-aged child has been diagnosed with strep throat. The parent asks the nurse when the child can return to school. Which is the nurse's best response? 1. 48 hours after the first documented normal temperature. 2. 24 hours after the first dose of antibiotics. 3. 48 hours after the first dose of antibiotics. 4. 24 hours after the first documented normal temperature. The correct answer is 2. 24 hours after the first dose of antibiotics. Children with strep throat are no longer contagious 24 hours after initiation of antibiotic therapy. An antenatal client is informing the nurse of her prenatal signs and symptoms. Which of the following findings would the nurse determine are presumptive signs of pregnancy? Select all that apply. 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. 4. Frequent urination. 5. Uterine growth. The correct answers are 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. And 4. Frequent urination. There are 3 classifications of signs of pregnancy: presumptive, probable, and positive. Signs that are totally subjective or presumptive include amenorrhea, breast tenderness, quickening, and frequent urination. Signs that are objective but not totally absolute are termed probable and include alterations in uterine shape and size and softening of the cervix. Signs that are absolute or positive include hearing the fetal heartbeat, detecting fetal movement by a healthcare provider, and seeing ultrasound images of the fetal outline. When assessing the psychological adjustment of an 8-week gravida, which of the following would the nurse expect to see signs of? 1. Ambivalence. 2. Depression. 3. Anxiety. 4. Ecstasy. The correct answer is 1. Ambivalence. It is common for women to be ambivalent about their pregnancy during the first trimester. Even women who stop taking birth control pills to become pregnant are often startled and ambivalent when they actually get pregnant. This is not pathological. The women usually slowly accept the pregnancy, and by 20 weeks gestation are happy and enthusiastic about the prospect of becoming a mother. The nurse is reviewing discharge instructions with the parents of a child who had a tonsillectomy a few hours ago. The parents tell the nurse that the child is a big eater and they want to know what foods to give the child for the next 24 hours. What is the nurse's best response? 1. The child's diet should not be restricted at all. 2. The child's diet should be restricted to clear liquids. 3. The child's diet should be restricted to ice cream and cold liquids. 4. The child's diet should be restricted to soft foods. The correct answer is 4. The child's diet should be restricted to soft foods. Soft foods are recommended to limit the child's pain and to decrease the risk for bleeding. You can eliminate answer 1 by knowing there are usually some dietary restrictions following any surgical procedure. The nurse is assessing the laboratory report of a 40-week gestation client. Which of the following values would the nurse expect to find elevated above pre-pregnancy levels? Select all that apply. 1. Glucose. 2. Fibrinogen. 3. Hematocrit. 4. Bilirubin. 5. White blood cells. The correct answers are 2. Fibrinogen and 5. White blood cells. Fibrinogen levels will be elevated slightly in a 40-week pregnant woman because coagulation factors like fibrinogen increase to help prevent excessive blood loss during delivery. A 40-week pregnant woman's white blood cell count will be elevated above normal as a means of protecting her body from infection. How does the nurse interpret the laboratory analysis of a stool sample containing excessive amounts of azoturia and steatorrhea in a child with cystic fibrosis? The values indicate the child is 1. Not compliant with taking her vitamins. 2. Not compliant with taking her enzymes. 3. Eating too many foods high in fat. 4. Eating too many foods high in fiber. The correct answer is 2. Not compliant with taking her enzymes. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. A school-age child is admitted to the hospital for a tonsillectomy. During the nurse's post-operative assessment, the child's parent tells the nurse that the child is in pain. Which of the following observations would be of most concern to the nurse? 1. The child's heart rate and blood pressure are elevated. 2. The child complains of having a sore throat. 3. The child is refusing to eat solid foods. 4. The child is swallowing excessively. The correct answer is 4. The child is swallowing excessively. Excessive swallowing is a sign that the child is swallowing blood. This should be considered a medical emergency, and the healthcare provider should be contacted immediately. The child is likely bleeding and will need to return to surgery. When analyzing the need for health teaching of a prenatal multigravida, the nurse should ask which of the following questions. 1. What are the ages of your children? 2. What is your marital status? 3. Do you ever drink alcohol? 4. Do you have any allergies? The correct answer is 3. Do you ever drink alcohol? All of the possible responses are questions that should be asked of a pregnant multigravida, but only one is related to the client's needs for health teaching. A child is complaining of throat pain. Which statement by the mother indicates that she needs more education regarding the care and treatment of her child's pharyngitis? 1. I will have my child gargle with salt water 3 times a day. 2. I will offer my child ice chips several times a day. 3. I will give my child Tylenol every 4 to 6 hours as needed. 4. I will ask the nurse practitioner for some amoxicillin. The correct answer is 4. I will ask the nurse practitioner for some amoxicillin. Pharyngitis is a self-limiting viral illness that does not require antibiotic therapy. Pharyngitis should be treated with rest and comfort measures, including Tylenol, throat sprays, cold liquids, and popsicles. A woman whose prenatal weight was 105 pounds, weighs 109 pounds, at her 12-week visit. Which of the following comments by the nurse is appropriate at this time? 1. We expect you to gain about 1 pound per week, so your weight is a little low at this time. 2. Most women gain no weight during the first trimester, so I would suggest you eat fewer desserts for the next few weeks. 3. You entered the pregnancy well underweight, so we should check your diet to make sure you are getting the nutrients you need. 4. Your weight gain is exactly what we would expect it to be at this time. The correct answer is 4. Your weight gain is exactly what we would expect it to be at this time. For women who enter the pregnancy with a normal weight for height, the expected weight gain is 3 to 5 pounds for the entire first trimester and approximately 0.8 to 1 pound per week from weeks 13 to 40. A child's parent asks the nurse what treatment the child will need for the diagnosis of strep throat. Which is the nurse's best response? 1. Your child will be sent home on bed rest and should recover in a few days without any intervention. 2. Your child will need to have the tonsils removed to prevent future strep infections. 3. Your child will need oral penicillin for 10 days and should feel better in a few days. 4. Your child will need to be admitted to the hospital for 5 days of intravenous antibiotics. The correct answer is 3. Your child will need oral penicillin for 10 days and should feel better in a few days. The child will need a 10-day course of penicillin amoxicillin to treat the strep infection. It is essential that the nurse always tell the family that, although the child will feel better in a few days, the entire course of antibiotics must be completed. Answer 2 can be eliminated because it is a treatment for recurrent tonsillitis, not strep throat. Answer 1 can be eliminated if the test taker understands that bacterial infections need to be treated with antibiotics. Because nausea and vomiting are such common complaints of pregnant women, the nurse provides anticipatory guidance to a 6-week gestation client by telling her to do which of the following? 1. Avoid eating greasy foods. 2. Drink orange juice before rising. 3. Consume 1 teaspoon of nutmeg each morning. 4. Eat 3 large meals plus a bedtime snack. The correct answer is 1. Avoid eating greasy foods. The stomach is extra sensitive during pregnancy, so the pregnant woman should try to avoid foods that will aggravate it even more. Most fatty, greasy, fried, or other generally unhealthy foods are not going to help settle the stomach. These make morning sickness worse. Saltine crackers should be eaten before rising. Drinking orange juice has not been recommended. Although consuming ginger may help to alleviate the nausea and vomiting of pregnancy, neither cinnamon nor nutmeg has been shown to alleviate the symptoms. It is recommended that mothers eat small, frequent meals throughout the day. A school-age child has been diagnosed with nasopharyngitis. The parent is concerned because the child has had little or no appetite for the last 24 hours. Which is the nurse's best response? 1. Do not be concerned. It is common for children to have a decreased appetite during a respiratory illness. 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. 3. Try offering the child some favorite foods. Maybe that will improve the appetite. 4. You need to force your child to eat whatever you can. Adequate nutrition is essential. The correct answer is 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. It is common for children to have a decreased appetite when they have a respiratory illness. The nurse is appropriately instructing the parent that the child will be fine by taking in an adequate amount of fluid, which will keep the child hydrated. Answer 4 can be eliminated because one should not force the child to eat. If the word encourage had been used, Answer 4 would have been a better choice, although still not the best answer. Answer 1 can be eliminated because the nurse did not inform the parent of the importance of maintaining adequate fluid intake. A client enters the prenatal clinic. She states that she missed her period yesterday and used a home pregnancy test this morning. She states that the results were negative, but I still think I am pregnant. Which of the following statements would be appropriate for the nurse to make at this time? 1. Your period is probably just irregular. 2. We could do a blood test to check. 3. Home pregnancy test results are very accurate. 4. You should repeat the test in 1 week. The correct answer is 2. We could do a blood test to check. Because quantitative pregnancy tests measure the exact quantity of human chorionic gonadotropin in the bloodstream, they are more accurate than urine tests that simply measure whether or not the hormone is present in the urine. Similar to the urine tests on the market, Qualitative serum tests detect whether or not the hormone is present, but they are still considered to be more accurate than urine tests. A 7-month-old has a low-grade fever, nasal congestion, and a mild cough. What should the nursing care management of this child include? Select all that apply. 1. Maintaining strict bed rest. 2. Avoiding contact with family members. 3. Instilling saline nose drops and bulb suctioning. 4. Keeping the head of the bed flat. 5. Providing humidity and propping the head of the bed up. The correct answers are 3. Instilling saline nose drops and bulb suctioning, and 5. Providing humidity and propping the head of the bed up. Infants are nose breathers and often have increased difficulty when they are congested. Nasal saline drops and gentle suctioning with a bulb syringe are often recommended. Other helpful suggestions for infants with colds are to provide humidity with a cool mist humidifier or take them into a steamy bathroom. In addition, raising the head of the bed helps with drainage of secretions. You can eliminate answer 4 given a basic understanding of interventions to improve respiratory function. Agravida G1 P0000 is having her first prenatal physical examination. Which of the following assessments should the nurse inform the client that she will have that day? Select all that apply. 1. Pap smear. 2. Mammogram. 3. Glucose tolerance test. 4. Biophysical profile. 5. Complete blood count. The correct answers are 1. Pap smear and 5. Complete blood count. At the first prenatal visit, pregnant clients will undergo complete obstetrical and medical physical assessments. The assessments are performed to provide the healthcare practitioner with baseline data regarding the health and well-being of the woman, as well as to inform the healthcare practitioner of any medical problems that the mother has that might affect the pregnancy. A breast examination will be performed by the practitioner to assess for abnormalities, but since mammograms are potentially harm-producing X-rays, they are ordered only in emergent cases. A glucose assessment will likely be performed at the end of the second trimester. A biophysical profile may be done, but not until the third trimester. The parents of a 5-week-old have just been told that their child has cystic fibrosis. The mother had a sister who died of CF when she was 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy. What is the nurse's best response? 1. The life expectancy for CF patients has improved significantly in recent years. 2. Your child might not follow the same course that the mother's sister did. 3. The healthcare provider will come to speak to you about treatment options. 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The correct answer is 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The nurse's best intervention is to listen as the parents express their concerns and fears. The nurse's answers should be brief, knowing that the parents are not able to process information right now. The nurse should be available later if the parents have any other concerns or questions, or if they just need someone with whom to talk. The nurse plans to provide anticipatory guidance to a 10 weeks pregnant client who is being seen in the prenatal clinic. Which of the following information should be a priority for the nurse to provide? 1. Pain management during labor. 2. Methods to relieve backaches. 3. Breastfeeding positions. 4. Characteristics of the newborn. The correct answer is 2. Methods to relieve backaches. This 10-week pregnant client will be entering the second trimester in a couple of weeks. As the uterine body grows, the client is likely to experience backaches. It is appropriate for the nurse to provide information about this possibility and ways to relieve them. The parent of a child with cystic fibrosis asks the nurse what will be done to relieve the child's constipation. Which is the nurse's best response? 1. Your child likely has an obstruction and will require surgery. 2. Your child will likely be given IV fluids. 3. Your child will likely be given Miralax. 4. Your child will be placed on a clear liquid diet. The correct answer is 3. Your child will likely be given Me-Relax. CF clients with constipation commonly receive a stool softener or an osmotic solution such as Me-Relax orally to relieve their constipation. Answers 1 and 2 can be eliminated because surgery and IV fluids are not indicated for constipation. A client asks the nurse what was meant when the physician told her she had a positive Chadwick sign. Which of the following information about the finding would be appropriate for the nurse to convey at this time? 1. It is a purplish stretch mark on your abdomen. 2. It means that you are having heart palpitations. 3. It is a bluish coloration of your cervix and vagina. 4. It means the doctor heard abnormal sounds when you breathed in. The correct answer is 3. It is a bluish coloration of your cervix and vagina. Chadwick sign is a probable sign of pregnancy. The bluish coloration is a result of the increase in vascularization of the area in response to the high levels of circulating estrogen in the pregnant woman's system. A 2-year-old has just been diagnosed with cystic fibrosis. The parents ask the nurse what early respiratory symptoms they should expect to see in their child. Which is the nurse's best response? 1. You can expect your child to develop a barrel-shaped chest. 2. You can expect your child to develop a chronic productive cough. 3. You can expect your child to develop bronchiectasis. 4. You can expect your child to develop wheezing respirations. The correct answer is 4. You can expect your child to develop wheezing respirations. Wheezing respirations and a dry, non-productive cough are common early symptoms in CF. Answer 2 can be eliminated because of the word chronic. Chronic implies that the disease process is advanced rather than in the initial stages. Answers 1 and 3 can be eliminated if you know of the signs and symptoms of advanced lung disease. A client enters the prenatal clinic. She states that she believes she is pregnant. Which of the following hormone elevations will indicate a high probability that the client is pregnant? 1. Chorionic gonadotropin. 2. Oxytocin. 3. Prolactin. 4. Luteinizing hormone. The correct answer is 1. Chorionic gonadotropin. Human chorionic gonadotropin is produced by the fertilized egg. Its presence in the bloodstream signals the body to keep the corpus luteum alive. Until the placenta takes over the function of producing progesterone and estrogen, the corpus luteum produces the hormones that are essential to the maintenance of the pregnancy. Oxytocin is the hormone of labor. It is not measured as a sign of pregnancy. Prolactin is the hormone that stimulates lactogenesis immediately after delivery. It is not measured as a sign of pregnancy. Luteinizing hormone is the hormone that stimulates ovulation. It is not measured as a sign of pregnancy. The parent of a child with cystic fibrosis is excited about the possibility of the child receiving a double lung transplant. What should the parent understand? 1. The transplant will cure the child of CF and allow the child to lead a long and healthy life. 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. 3. The transplant will help to reverse the multisystem damage that has been caused by CF. 4. The transplant will be the child's only chance at surviving long enough to graduate from college. The correct answer is 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. A 16-year-old G1P0000 is being seen at her 10-week gestation visit. She tells the nurse that she felt the baby move that morning. Which of the following responses by the nurse is appropriate? 1. That is very exciting. The baby must be very healthy. 2. Would you please describe what you felt for me? 3. That is impossible. The baby is not big enough yet. 4. Would you please let me see if I can feel the baby? The correct answer is 2. Would you please describe what you felt for me? Quickening, or subjective fetal movement, occurs between 16 and 20 weeks gestation. At 10 weeks gestation, it would be impossible for the young woman to feel fetal movement. The nurse, therefore, should elicit more information from the teen to determine what she had felt. The parent of an infant with cystic fibrosis asks the nurse how to meet the child's increased nutritional needs. Which is the nurse's best suggestion? 1. You may need to increase the number of fresh fruits and vegetables you give your infant. 2. You may need to advance your infant's diet to whole cow's milk because it is higher in fat than formula. 3. You may need to change your infant to a higher calorie formula. 4. You may need to increase your infant's carbohydrate intake. The correct answer is 3. You may need to change your infant to a higher calorie formula. Often, infants with CF need to have a higher calorie formula to meet their nutritional needs. Infants may also be placed on hydrolysate formulas that contain medium-chain triglycerides. A 20-year-old client states that the at-home pregnancy test that she took this morning was positive. Which of the following comments by the nurse is appropriate at this time? 1. Congratulations, you and your family must be so happy. 2. Have you told the baby's father yet? 3. How do you feel about the results? 4. Please tell me when your last menstrual period was. The correct answer is 3. How do you feel about the results? Some pregnant women are happy about their pregnancy, some are sad, and still others are frightened. At the initial interview, it is essential that the nurse not assume that the woman will respond in any particular way. The nurse must ask open-ended questions to elicit the woman's feelings about the pregnancy. The parent of a 4-month-old with cystic fibrosis asks the nurse what time to begin the child's first chest physiotherapy each day. Which is the nurse's best response? 1. 30 minutes before feeding the child breakfast. 2. After deep suctioning the child each morning. 3. 30 minutes after feeding the child breakfast. 4. Only when the child has congestion or coughing. The correct answer is 1. 30 minutes before feeding the child breakfast. CPT should be done in the morning prior to feeding to avoid the risk of the child vomiting. A client is in the 10th week of her pregnancy. Which of the following symptoms would the nurse expect the client to exhibit? Select all that apply. 1. Backache. 2. Urinary frequency. 3. Dyspnea on exertion. 4. Fatigue. 5. Diarrhea. The correct answers are 2. Urinary frequency, and 4. Fatigue. During the first trimester, the body undergoes a number of important changes. The embryo is developing, the hormones of the body are increasing, and the maternal blood supply is increasing. To accomplish each of the tasks, the body uses energy. The mother is fatigued not only because the body is undergoing great change, but also because the thyroid gland has not caught up with the increasing energy demands. In addition, because the organs are confined within the bony pelvis, the enlarging uterus prevents the bladder from expanding with large quantities of urine. As a result, the woman needs to urinate much more frequently than she did prior to becoming pregnant. Which would the nurse explain to parents about the inheritance of cystic fibrosis? 1. CF is an autosomal dominant trait passed on from the child's mother. 2. CF is an autosomal dominant trait passed on from the child's father. 3. The child of parents who are both carriers of the gene for CF has a 50% chance of acquiring CF. 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. The correct answer is 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. If the child is born to a parent with CF and the other parent is a carrier, the child has a 50% chance of acquiring the disease and a 50% chance of being a carrier of the disease. The midwife has just palpated the fundal height at the location noted on the picture below. It is likely that the client is how many weeks pregnant? 1. 12 weeks. 2. 20 weeks. 3. 28 weeks. 4. 36 weeks. The correct answer is 1. 12 weeks. The client is likely 12 weeks pregnant. At 12 weeks, the fundal height is at the top of the symphysis. The fundal height is assessed at every prenatal visit. It is an easy, non-invasive means of assessing fetal growth. The nurse should know that the top of the fundus is at the level of the symphysis at the end of the first trimester. Which data indicates to the nurse that simvastatin is effective? 1. The client's blood pressure is 132/80. 2. The client's cholesterol level is 180 milligrams per deciliter. 3. The client's LDL cholesterol level is 180 milligrams per deciliter. 4. The client's HDL cholesterol level is 35 milligrams per deciliter. The correct answer is 2. The client's cholesterol level is 180 milligrams per deciliter. Simvastatin is an HMG-CoA reductase inhibitor, or a statin that lowers cholesterol levels. A cholesterol level less than 200 milligrams per deciliter is desirable and indicates the medication is effective. The nurse is teaching the client diagnosed with angina about sublingual nitroglycerin. Which statement indicates the client needs more medication teaching? 1. I will always carry my nitroglycerin in a dark-colored bottle. 2. If I have chest pain, I will put a tablet underneath my tongue. 3. If my pain is not relieved with one tablet, I will get medical help. 4. I should expect to get a headache after taking my nitroglycerin. The correct answer is 3. If my pain is not relieved with one tablet, I will get medical help. The client should put one tablet under the tongue every 5 minutes, and if the chest pain is not relieved after taking 3 tablets, the client should seek medical attention. This statement indicates the client needs more teaching about the medication. The nurse is preparing to administer medications in a pulmonary unit. Which medication should the nurse administer first? 1. Prednisone for a client diagnosed with chronic bronchitis. 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. 3. Lactic acidophilus to a client receiving IVPB antibiotics. 4. Cephalexin to a client being discharged. The correct answer is 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. Oxygen is considered a medication and should be a priority whenever it is ordered. A client diagnosed with pneumonia will have some amount of respiratory compromise, and the ordered 2 liters per minute indicates a client with a chronic lung disease. This is the priority medication. Prednisone is a glucocorticoid steroid. This is an oral preparation and one that can be given daily. This is not the first medication to be administered. Lactic acidophilus is a biologic replacement and is administered to replace the good bacteria in the body destroyed by the antibiotic, but it does not need to be administered first. Cephalexin is an oral antibiotic, but this client is being discharged, indicating the client's condition has improved. This client could wait until the oxygen is initiated. The client with the flu is prescribed the OTC cough suppressant dextromethorphan. Which information should the nurse teach regarding this medication? 1. Take the medication every 4 to 8 hours as needed for cough. 2. The medication can cause addiction if taken too long. 3. Do not drive or operate machinery while taking the drug. 4. Do not take a beta blocker while taking this medication. The correct answer is 1. Take the medication every 4 to 8 hours as needed for cough. Dextromethorphan is relatively safe in the recommended dose range of 10 to 30 milligrams every 4 to 8 hours. At these levels, it does not produce respiratory depression and side effects are not common. Dextromethorphan is an antitussive. This medication does not have the potential to cause addiction. This medication does not produce drowsiness, so driving or operating machinery while taking dextromethorphan is acceptable. The medication does not slow the heart rate, and there is no reason for a client not to take a prescribed beta blocker medication while taking dextromethorphan. The nurse is preparing to administer a nitroglycerin transdermal patch to the client diagnosed with a myocardial infarction. Which intervention should the nurse implement? 1. Question applying the patch if the client's blood pressure is less than 110/70. 2. Use bare hands when applying the transdermal patch. 3. Date and time the transdermal patch prior to applying to client's skin. 4. Place the transdermal patch on the site where the old patch was removed. The correct answer is 3. Date and time the transdermal patch prior to applying to client's skin. The nurse should remove the old patch, wash the client's skin, note the date and time the new patch is applied, and apply it in a new area that is not hairy. The transdermal patch must be rotated so that skin irritation will not occur. Nitroglycerin, a coronary vasodilator, causes hypotension, and the nurse should question administering a transdermal patch if the client's blood pressure is less than 90/60, but not if it is less than 110/70. The nurse is discharging a client diagnosed with COPD. Which discharge instructions should the nurse provide regarding the client's prescription for prednisone? 1. Take all the prednisone as ordered until the prescription is empty. 2. Take the prednisone on an empty stomach with a full glass of water. 3. Stop taking the prednisone if a noticeable weight gain occurs. 4. Do not abruptly discontinue taking the prednisone. The correct answer is 4. Do not abruptly discontinue taking the prednisone. Prednisone is a glucocorticoid steroid. Prednisone is not abruptly discontinued because cortisol is necessary to sustain life, and the adrenal glands stop producing cortisol while the client is taking it exogenously. Prednisone can produce gastric distress. It is given with food to minimize the gastric discomfort. Weight gain is a side effect of steroid therapy, and the client should not stop taking the medication if this occurs. This medication must be tapered off to prevent a life-threatening complication if the client is to stop the medication. The client diagnosed with arterial hypertension develops a cold. Which information regarding over-the-counter medications should the nurse teach? 1. Try to find a medication that will not cause drowsiness. 2. OTC medications are not as effective as a prescription. 3. OTC medications are more expensive than prescriptions. 4. Do not take OTC medication unless approved by the HCP. The correct answer is 4. Do not take OTC medication unless approved by the HCP. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. The client should only take medications approved by the HCP that will not affect the client's hypertension. The client should be informed about the dangers of self-medicating with OTC medications. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. Efficacy of medications depends on the medication and strength. The client is reporting severe chest pain radiating down the left arm and is nauseated and diaphoretic. The HCP suspects the client is having an MI and has ordered morphine sulfate for the pain. Which interventions should the nurse implement? Select all that apply. 1. Instruct the client not to get out of the bed without notifying the nurse. 2. Administer the morphine sulfate intramuscularly in the ventral gluteal muscle. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. 4. Administer the morphine sulfate slowly over 5 minutes. 5. Question the order because morphine sulfate should not be administered to a client with an MI. The correct answers are 1. Instruct the client not to get out of the bed without notifying the nurse. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. And 4. Administer the morphine sulfate slowly over 5 minutes. The client should not get out of the bed without assistance due to the drowsiness the client will experience after receiving morphine sulfate, a narcotic analgesic. Also, the client is having chest pain and should not get out of bed without assistance. Morphine sulfate, a narcotic analgesic, is the drug of choice for chest pain, and it is administered intravenously so that it acts as soon as possible, within 10 to 15 minutes. IVP medications should be diluted to help decrease the pain when it is administered and to prevent irritation to the vein. Morphine sulfate may be administered intravenously when a rapid onset of action is desired. The dose is usually in the range of 2.5 to 15 milligrams, given slowly over 4 to 5 minutes. The client diagnosed with emphysema is admitted to the surgical unit for a cholecystectomy. Which post-operative interventions should the nurse implement? Select all that apply. 1. Have the patient turn, cough, and breathe deeply every 2 hours. 2. Administer oxygen to the client at 4 liters per minute. 3. Assess the surgical dressing every 4 hours. 4. Medicate frequently with morphine 15 milligrams IV push. 5. Use the incentive spirometer every 4 hours. The correct answers are 1. Have the patient turn, cough, and breathe deeply every 2 hours. 3. Assess the surgical dressing every 4 hours. And 5. Use the incentive spirometer every 4 hours. Clients undergoing surgery are encouraged to turn, cough, and deep breathe a minimum of every 2 hours. Clients diagnosed with chronic lung disease are frequently prescribed long-term steroid therapy. Steroids delay wound healing. The nurse should assess the wound to determine that the surgical incision is healing as desired. The client should use the incentive spirometer to help prevent pneumonia. Every 4 hours is an appropriate time span. The client should be administered oxygen at 1 to 3 liters per minute. Clients with chronic lung disease have developed carbon dioxide narcosis. High levels of carbon dioxide have destroyed the client's first stimulus for breathing. Oxygen hunger is the body's backup system for sustaining life. Administering oxygen at levels above 2 liters per minute at rest and 3 liters per minute during activity may cause the client to stop breathing. The nurse is administering 9 o'clock medications to the following clients. Which client should the nurse question administering the medication? 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. 2. The client receiving a beta blocker who has an apical pulse of 62 beats per minute. 3. The client receiving a nitroglycerin patch who has a blood pressure of 148/92. 4. The client receiving an antiplatelet medication who has a platelet count of 150,000. The correct answer is 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. The client receiving a calcium channel blocker should avoid grapefruit juice because it can cause the calcium channel blocker to rise to toxic levels. Grapefruit juice can inhibit the metabolism of certain medications. Specifically, grapefruit juice inhibits cytochrome P450, 3A, 4 found in the liver and the intestinal wall. The nurse should investigate any medications the client is taking if the client drinks grapefruit juice. The female client is being admitted to a medical unit with a diagnosis of pneumonia. Which intervention would the nurse implement? Rank in order of performance. 1. Start an IV access line. 2. Administer the IVPB antibiotic. 3. Teach to notify the nurse of any vaginal itching. 4. Obtain sputum and blood cultures. 5. Place an identity band on the client. The correct order is 5. Place an identity band on the client. 4. Obtain sputum and blood cultures. 1. Start an IV access line. 2. Administer the IVPB antibiotic. And 3. Teach to notify the nurse of any vaginal itching. The laboratory technician who will draw the blood cultures will need the band to identify the client before drawing the specimen, and the nurse will need the band before administering the medication. Checking for the right client is one of the 6 rights of medication administration. Cultures are obtained prior to the initiation of antibiotics to prevent skewing of the results. An IV line must be initiated before the nurse can administer IV medications. IV antibiotics should be administered within 1 to 2 hours of the order being written. This should always be considered a now medication. Superinfections are a potential complication of antibiotic therapy. Vaginal yeast infections occur when the good bacteria are killed off by the antibiotic. Diarrhea from destruction of intestinal flora is also a possibility. The client diagnosed with angina who is prescribed nitroglycerin tells the nurse, "I don't understand why I can't take my sildenafil. I need to take it so that I can make love to my wife." Which statement is the nurse's best response? 1. If you take the medications together, they may cause you to have very low blood pressure. 2. You are worried your wife will be concerned if you cannot make love. 3. If you wait at least 8 hours after taking your nitroglycerin, you can take your sildenafil. 4. You should get clarification with your HCP about taking sildenafil. The correct answer is 1. If you take the medications together, they may cause you to have very low blood pressure. Life-threatening hypotension can result with concurrent use of NTG and sildenafil, a peripheral vasodilator erectile agent. The male client diagnosed with COPD tells the nurse that he has been expectorating rusty-colored sputum. Which medication should the nurse anticipate the HCP prescribing? 1. Prednisone. 2. Nicotine. 3. Dextromethorphan. 4. Ceftriaxone. The correct answer is 4. Ceftriaxone. Ceftriaxone is an antibiotic. The client's rusty-colored sputum indicates an infection, and an antibiotic should be ordered. Rocephin is a broad-spectrum antibiotic. Prednisone is a glucocorticoid. Clients diagnosed with COPD are commonly prescribed a steroid medication to decrease inflammation in the lungs. This client should already be taking this or a similar medication. The client should quit smoking, if still smoking. A transdermal nicotine system, such as Habitrol, would be anticipated to aid the client. Dextromethorphan is an antitussive. The client may require an antitussive, but more likely would require a mucolytic to help to expectorate the thick, tenacious sputum associated with COPD. The client diagnosed with a myocardial infarction is receiving thrombolytic therapy. Which data warrants immediate intervention by the nurse? 1. The client's telemetry has reperfusion dysrhythmias. 2. The client is oozing blood from the IV site. 3. The client is alert and oriented to date, time, and place. 4. The client has no signs of infiltration at the insertion site. The correct answer is 2. The client is oozing blood from the IV site. Any bleeding from the IV site, gums, rectum, or vagina should be reported to the HCP. The HCP may not be able to take intervention to prevent the bleeding during therapy, but it warrants notifying the HCP. The nurse in a medical unit is administering 9 o'clock medications. Which medication should the nurse question administering? 1. Acetylcysteine to a client who is coughing forcefully. 2. Cefazolin IV piggyback to a client diagnosed with the flu. 3. Diphenhydramine to a client who is congested. 4. Dextromethorphan to a client who has pneumonia. The correct answer is 1. Acetylcysteine to a client who is coughing forcefully. Acetylcysteine is a mucolytic. An adverse effect of mucomist is bronchospasm. This client should be assessed for bronchospasm before administering a dose of mucomist. Cefazolin is an antibiotic. Antibiotics are frequently administered to clients with viral infections to prevent secondary bacterial infections. This client is considered at risk, or the client would not be in a hospital receiving care. There is no reason to question this medication. Diphenhydramine is an antihistamine. Antihistamines are prescribed for congestion, so there is no reason to question this medication. Dextromethorphan is an antitussive. A symptom of pneumonia is a cough, so there is no reason to question this medication. The nurse is completing AM care with a client diagnosed with angina when the client reports chest pain. The client has a saline lock in the right forearm. Which intervention should the nurse at the bedside implement first? 1. Assess the client's vital signs. 2. Administer sublingual nitroglycerin. 3. Administer IV morphine sulfate via saline lock. 4. Administer oxygen via nasal cannula. The correct answer is 4. Administer oxygen via nasal cannula. The nurse would have oxygen at the bedside, and applying it would be the first intervention the nurse could implement at the bedside. The client diagnosed with the flu is prescribed the cough medication hydrocodone. Which information should the nurse teach the client regarding this medication? 1. Teach the client to monitor the bowel movements for constipation. 2. Tell the client that it is fine to drive or operate machinery while taking this medication. 3. Instruct the client to plan for rest periods, as this medication usually causes insomnia. 4. Explain that this medication is more effective when taken with a mucolytic. The correct answer is 1. Teach the client to monitor the bowel movements for constipation. Hydrocodone is an opioid and can slow the peristalsis of the bowel, resulting in constipation. The client should be aware of this and increase the fluid intake and use bulk laxatives and stool softeners if needed. Opioids can cause drowsiness, so driving or operating machinery should be discouraged. Opioids usually cause the client to be drowsy and not have insomnia. Hydrocodone is a cough suppressant and a mucolytic is an expectorant. These are opposite-acting medications. The client being discharged after sustaining an acute MI is prescribed lisinopril. Which instruction should the nurse include when teaching about this medication? 1. Instruct the client to monitor the blood pressure weekly. 2. Encourage the client to take medication on an empty stomach. 3. Discuss the need to rise slowly from lying to a standing position. 4. Teach the client to take the medication at night only. The correct answer is 3. Discuss the need to rise slowly from lying to a standing position. This medication causes orthostatic hypotension, and the client should be instructed to rise slowly from lying to sitting to standing position to prevent falls and injury. Which statement is the scientific theory for prescribing zinc preparations for a client with a cold? 1. Zinc binds with the viral particle and reduces the symptoms of a cold. 2. Zinc decreases the immune system's response to a virus. 3. Zinc activates viral receptors in the body's immune system. 4. Zinc blocks the virus from binding to the epithelial cells of the nose. The correct answer is 4. Zinc blocks the virus from binding to the epithelial cells of the nose. Theoretically, zinc blocks viral binding to nasal epithelium. Observation has shown that increased amounts of zinc can prevent the binding and prevent the development of symptoms of the rhinovirus. Zinc does not bind the viral particle. Symptoms are diminished by blocking the ability of the virus to bind with the nasal lining. Zinc is a micronutrient found in the body that helps to increase the body's immune system. Activating viral receptors would increase the symptoms of a cold. The client calls the clinic and says, "I am having chest pain. I think I'm having another heart attack." Which intervention should the nurse implement first? 1. Call 911 emergency medical services. 2. Instruct the client to take an aspirin. 3. Determine if the client is at home alone. 4. Ask if the client has any sublingual nitroglycerin. The correct answer is 4. Ask if the client has any sublingual nitroglycerin. Because the client has had one MI, the client may have sublingual nitroglycerin, a coronary vasodilator, in a pocket and can take it immediately. If the client does not have any on the body, then the nurse should determine if there is anyone in the home that can help the client. The client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. Which information should the nurse teach? 1. Increase the amount of sprays used until the desired effect has been reached. 2. This type of medication can cause rebound congestion if used too long. 3. Alternate the oxymetazoline with a saline nasal spray every 2 hours. 4. Place the oxymetazoline nasal spray in a vaporizer at night for the best results. The correct answer is 2. This type of medication can cause rebound congestion if used too long. Oxymetazoline is a nasal decongestant. Oxymetazoline is recommended for short-term relief of nasal congestion for clients older than the age of 6. This medication is for short-term use only. Longer use can cause a rebound congestion that can be difficult to resolve. Oxymetazoline should be used every 10 to 12 hours only. Using it more often increases the chance of developing a dependence on the medication and rebound congestion. Oxymetazoline nasal spray is to be used intranasally. It is not an additive for a vaporizer. The nurse is administering 0.5 inch of nitroglycerin paste. How much paste should the nurse apply to the application paper? 1. A. 2. B. 3. C. 4. D. The correct answer is 1. A. The line is in increments of 0.5 inch, and the order is 0.5 inch. Therefore, the nurse should apply this much paste. Which OTC herb should be usually recommended for a client with a cold who has mild hypertension? 1. Hawthorn. 2. Ginger. 3. Garlic. 4. Golden seal. The correct answer is 3. Garlic. Garlic is used for colds and the flu and can also be given for hypertension. It causes mild vasodilation and will not make hypertension worse. Hawthorn is used for mild hypertension, congestive heart failure, and angina, but it does nothing for a cold or the flu. Golden seal is used for respiratory, digestive, and urinary infections, but it increases the effectiveness of some antihypertensive medications, beta blockers, and antidysrhythmics. It should be used with caution in clients who have cardiovascular disease, diabetes mellitus, or glaucoma. The client diagnosed with coronary artery disease is prescribed atorvastatin. Which statement by the client warrants the nurse notifying the HCP? 1. I really haven't changed my diet, but I am taking my medication every day. 2. I am feeling pretty good, except I am having muscle pain all over my body. 3. I am swimming at the local pool about 3 times a week for 30 minutes. 4. I am taking this medication first thing in the morning with a bowl of oatmeal. The correct answer is 2. I am feeling pretty good, except I am having muscle pain all over my body. Atorvastatin is an HMG-CoA reductase inhibitor, or a statin. Statins can cause muscle injury, which can lead to myositis, fatal rhabdomyolysis, or myopathy. Muscle pain or tenderness should be reported to the HCP immediately. Usually the medication is discontinued. The client with the flu has been taking acetylcysteine. Which adverse effect should the nurse assess for? 1. Bronchospasm. 2. Nausea. 3. Fever. 4. Drowsiness. The correct answer is 1. Bronchospasm. Acetylcysteine is a mucolytic. Mucomist can cause bronchospasm, which will impair the client's breathing, not improve it. An adverse reaction is a reason to immediately discontinue the medication. Nausea is a side effect of many medications and can usually be managed by taking the medication with food. A side effect is not an adverse effect. Fever would result from the cold, flu, or infection, not from the medication. Drowsiness is caused by some cold and flu preparations, usually antihistamines. Mucomist causes the client to expectorate secretions, which will keep the client awake. The client diagnosed with coronary artery disease is instructed to take 81 milligrams of aspirin. Which statement best describes the scientific rationale for prescribing this medication? 1. This medication will help thin the client's blood. 2. Daily aspirin will decrease the incidence of angina. 3. This medication will prevent platelet aggregation. 4. Baby aspirin will not cause gastric distress. The correct answer is 3. This medication will prevent platelet aggregation. When 81 milligrams of aspirin, a baby aspirin, is taken daily, it helps prevent platelet aggregation, which, in turn, helps the blood pass through the narrowed arteries more easily. The mother of a teenage girl asks the nurse why her daughter would have many boxes of pseudoephedrine in her room. Which statement is the nurse's best response? 1. Has your child always had allergy problems? 2. Teenagers will try to take care of their own health problems. 3. Has your daughter's behavior at school or at home changed recently? 4. Remove the medication and say nothing to your daughter about it. The correct answer is 3. Has your daughter's behavior at school or at home changed recently? Pseudoephedrine is an antihistamine and is used in the manufacture of methamphetamines. This situation could indicate the teenager is involved with the drug culture, taking or manufacturing drugs. The nurse should assess for signs of drug involvement. The client with coronary artery disease is prescribed cholestyramine. Which intervention should the nurse implement when administering the medication? 1. Administer the medication with fruit juice. 2. Instruct the client to decrease fiber when taking the medication. 3. Monitor the cholesterol level before giving medication. 4. Assess the client for upper abdominal discomfort. The correct answer is 1. Administer the medication with fruit juice. Cholestyramine is a bile acid sequestrant. This medication should be administered with water, fruit juice, soup, or pulpy fruit such as pineapple to reduce the risk of esophageal irritation. The HCP prescribed amoxicillin clavulanate for a client diagnosed with chronic obstructive pulmonary disease who has a cold. Which intervention should the nurse implement? 1. Discuss the prescription with the HCP because antibiotics do not help viral infections. 2. Teach the client to take all the antibiotics as ordered. 3. Encourage the client to seek a second opinion before taking the medication. 4. Ask the client if he or she is allergic to sulfa drugs or shellfish. The correct answer is 2. Teach the client to take all the antibiotics as ordered. Amoxicillin clavulanate is an antibiotic. Clients prescribed antibiotics should always be taught to take all the medication as ordered to prevent resistant strains of bacteria from developing. Antibiotics do not treat viral infections, but HCPs will frequently prescribe prophylactic antibiotics for clients with comorbid conditions, such as COPD, to prevent a secondary bacterial infection. There is no reason for a second opinion, as this is standard medical practice. This is a penicillin preparation, not a sulfa medication or iodine. The elderly client diagnosed with coronary artery disease has been taking aspirin daily for more than a year. Which data warrants notifying the HCP? 1. The client has lost 5 pounds in the last month. 2. The client has trouble hearing low tones. 3. The client reports having a funny taste in the mouth. 4. The client has hard, dark, tarry stools. The correct answer is 4. The client has hard, dark, tarry stools. A complication of long-term aspirin use is gastric bleeding, which could result in dark, tarry stools. This data would warrant further intervention. The nurse is discharging a client 2 days post-operative hiatal hernia repair. Which discharge instructions should the nurse include? Select all that apply. 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. 3. Use the legs to bend down, not the back. 4. Take esomeprazole twice a day. 5. Use the pain medication when the pain is at 8 through 10. The correct answers are 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. And 3. Use the legs to bend down, not the back. Prophylactic antibiotics are frequently prescribed both pre-surgery and post-surgery. The client should be instructed to take all the medication as directed. Hiatal hernia repair may not last, and the client should continue the recommended lifestyle modifications, such as eating small meals. Part of the lifestyle modifications for hiatal hernia is to limit pressure on the abdominal cavity, especially after a meal. Using the leg muscles to bend down, rather than bending over, should be taught to the client. Esomeprazole is administered daily, not twice a day. For the best relief, pain medication should be taken at the onset of the pain. The client should not wait until the pain is an 8 to 10 before taking the pain medication. The client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? 1. There are no medications to treat this problem, but losing weight will sometimes help the symptoms. 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. 3. Have you had any X-rays or other tests to determine if you have cancer or some other serious illness? 4. Acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. The correct answer is 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. PPIs, H2 blockers, and antacids all treat the symptoms of acid reflux. The nurse should encourage the client to discuss which medication is best with the HCP. Sometimes losing weight will help relieve symptoms, but the client did not ask about lifestyle modifications. The symptoms do not indicate cancer. The nurse should not scare the client. Acid reflux can lead to complications, including adult-onset asthma that should be treated, but most HCPs will empirically treat the symptoms of acid reflux before ordering tests to determine the cause or possible complications. The nurse is teaching the client with type 1 diabetes how to use an insulin pen injector. Which information should the nurse discuss with the client? 1. Instruct the client to dial in the number of insulin units needed to inject. 2. Demonstrate the proper way to draw up the insulin in an insulin syringe. 3. Discuss that the insulin pen injector must be used in the abdominal area only. 4. Explain that the traditional insulin syringe is less painful than the injector pen. The correct answer is 1. Instruct the client to dial in the number of insulin units needed to inject. The insulin pen injector resembles a fountain pen. It contains a disposable needle and insulin-filled cartridge. When the client operates the insulin pen, the correct dose is obtained by turning the dial to the number of insulin units needed. The insulin pen injector does not require drawing up insulin in a syringe. The insulin pen injector can be used in any subcutaneous site where traditional insulin can be injected. Most clients state that there is less injection pain associated with the insulin pen than there is with the traditional insulin syringe. The client with type 2 diabetes has been admitted into the medical department with a wound on the left leg that will not heal. The HCP prescribes sliding scale insulin. The client tells the nurse, "I don't want to have to take shots. I take pills at home." Which statement is the nurse's best response? 1. If you can't keep your glucose under control with pills, you must take insulin. 2. You should discuss the insulin order with your HCP because you don't want to take it. 3. You are worried about having to take insulin. I will sit down and we can talk. 4. During illness, you may need to take insulin to keep your blood glucose level down. The correct answer is 4. During illness, you may need to take insulin to keep your blood glucose level down. Blood glucose levels elevate during times of stress, surgery, or serious infection. The client with type 2 diabetes may need to be given insulin temporarily to help keep the blood glucose level within normal limits. The statement in option 1 is a threatening type of statement and is not the nurse's best response. Insulin may need to be prescribed in times of stress, surgery, or serious infection. Therefore, the nurse should explain this to the client and not refer the client to the HCP. Option 4 is a therapeutic response, and the client needs to have factual information. Therapeutic responses are used to encourage the client to ventilate feelings. The nurse in a medical unit has received the morning report. Which medication should the nurse administer first? 1. Pantoprazole to a client on call to surgery. 2. Calcium carbonate to a client reporting indigestion. 3. Bismuth to a client diagnosed with an ulcer. 4. Famotidine to a client diagnosed with gastroesophageal reflux disease. The correct answer is 1. Pantoprazole to a client on call to surgery. Pantoprazole is a proton pump inhibitor. A medication for a client on call to surgery is a priority. The client's surgery could be delayed if the medication has not been administered when the call to surgery comes. Calcium carbonate is an antacid. This would be the second medication to administer, as this client has a report of discomfort. Bismuth is an antimicrobial. This medication is a routine medication and could be administered at any time. Famotidine is an H2 blocker. This medication is a routine medication and could be administered at any time. The nurse administered 25 units of insulin isophane to a client with type 1 diabetes at 1600 hour. Which intervention should the nurse implement? 1. Assess the client for hypoglycemia around 1800 hour. 2. Ensure the client eats the nighttime snack. 3. Check the client's serum blood glucose level. 4. Serve the client the supper tray. The correct answer is 2. Ensure the client eats the nighttime snack. The nurse needs to ensure the client eats the nighttime snack to help prevent nighttime hypoglycemia. Insulin isophane is an intermediate-acting insulin that peaks 6 to 8 hours after administration. Therefore, the client would experience signs of hypoglycemia around 2200 hour to 2400 hour. A serum blood glucose level would have to be done with a venipuncture, and the blood sample must be taken to the laboratory. If the client needed the blood glucose checked, it should be done with a glucometer at the bedside. The supper tray would not help prevent a hypoglycemic reaction because the insulin isophane humulin N is an intermediate-acting insulin that peaks in 6 to 8 hours. The client diagnosed with type 2 diabetes is receiving the combination oral medication glyburide metformin. Which data indicates the medication is effective? 1. The client's skin turgor is elastic. 2. The client's urine ketones are negative. 3. The serum blood glucose level is 118 milligrams per deciliter. 4. The client's glucometer level is 170 milligrams per deciliter. The correct answer is 3. The serum blood glucose level is 118 milligrams per deciliter. Glyburide metformin contains both the sulfonylurea and biguanide. The serum blood glucose level should be within normal limits, which is 70 to 110 milligrams per deciliter. A level of 118 milligrams per deciliter is close to normal. Therefore, the medication can be considered effective. An elastic skin turgor is expected and normal, but it does not indicate that the anti-diabetic medication is effective. Urine ketones should be negative because there should not be a breakdown of fat in clients with type 2 diabetes, but this does not indicate the effectiveness of the medication. A self-monitoring blood glucose level of 170 milligrams per deciliter is above a normal glucose level. This indicates the medication is not effective. Which statement is the scientific rationale for administering a proton pump inhibitor to a client diagnosed with gastroesophageal reflux disease? 1. PPI medications neutralize the gastric secretions. 2. PPI medications block H2 receptors on the parietal cells. 3. PPI medications inhibit the enzyme that generates gastric acid. 4. PPI medications form a protective barrier against acid and pepsin. The correct answer is 3. PPI medications inhibit the enzyme that generates gastric acid. PPIs inhibit the enzyme that generates gastric acid. Antacids, not PPIs, neutralize gastric secretions. H2 blockers block receptors on the parietal cells. Mucosal barrier agents form a protective barrier against acid and pepsin. The nurse is discussing oral glyburide with the client diagnosed with type 2 diabetes. Which information should the nurse discuss with the client? 1. Instruct the client to take the oral hypoglycemic medication with food. 2. Explain that hypoglycemia will not occur with oral medications. 3. Tell the client to notify the HCP if a headache, nervousness, or sweating occurs. 4. Recommend that the client check the ketones in the urine every morning. The correct answer is 1. Instruct the client to take the oral hypoglycemic medication with food. Glyburide is a sulfonylurea that stimulates the pancreatitis to secrete more insulin. The oral hypoglycemic medication should be administered with food to decrease gastric upset. The client receiving oral hypoglycemic medications can experience hypoglycemic reactions, as can clients receiving insulin. In option 3, these are signs or symptoms of hypoglycemia, and the client should be able to treat this without notifying the HCP. Ketones are a byproduct of the breakdown of fats, which usually does not occur in clients with type 2 diabetes because the client has enough insulin to prevent breakdown of fats, but not enough to keep the blood glucose level within an acceptable level. Which statement is an advantage to administering a histamine 2 blocker rather than an antacid to a client diagnosed with gastroesophageal reflux disease? 1. Antacids are more potent than H2 blockers in relieving the symptoms of gastroesophageal reflux disease. 2. H2 blockers have more side effects than antacids. 3. H2 blockers are less expensive than antacids. 4. H2 blockers require less frequent dosing than antacids. The correct answer is 4. H2 blockers require less frequent dosing than antacids. H2 blockers require less frequent administration than do antacids, which require frequent administration 7 or more times a day for therapeutic effects. The fewer times a client is expected to take a medication, the more likely the client is to comply with a medication regimen. H2 blockers actually block the production of gastric acid and have a longer effect than an antacid. An increase in side effects would not be an advantage. Antacids are usually less expensive than H2 blockers. Which statement best describes the scientific rationale for prescribing metformin? 1. This medication decreases insulin resistance, improving blood glucose control. 2. This medication allows the carbohydrates to pass slowly through the large intestine. 3. This medication will decrease the hepatic production of glucose from stored glycogen. 4. This medication stimulates the beta cells to release more insulin into the bloodstream. The correct answer is 3. This medication will decrease the hepatic production of glucose from stored glycogen. Metformin is a biguanide that works to prevent gluconeogenesis in the liver. The scientific rationale for administering metformin is that it diminishes the increase in serum glucose following a meal and blunts the degree of postprandial hyperglycemia by preventing gluconeogenesis. A thiazolidinedione, pioglitazone, or rosiglitazone, not a biguanide like metformin, is prescribed to decrease insulin resistance. An alpha-glucosidase inhibitor, acarbose or miglatol, is administered to allow carbohydrates to pass slowly through the intestine. Glucophage does not do this. Meglitinide, repaglinide, sulfonylurea, or natglinide is prescribed to stimulate the beta cells to release more insulin into the bloodstream. Which side effects should the nurse explain to the male client who is prescribed cimetidine? 1. The medication can cause indigestion and heartburn. 2. The medication can cause impotence and gynecomastia. 3. The medication can cause insomnia and hypervigilance. 4. The medication can cause Zollinger-Ellison syndrome. The correct answer is 2. The medication can cause impotence and gynecomastia. Cimetidine is an H2 blocker. Over time, cimetidine can cause males to become impotent, have decreased libido, and have breast development. Cimetidine, an H2 blocker, is used to treat indigestion and heartburn. Cimetidine can cause lethargy and somnolence, not insomnia and hypervigilance. Cimetidine is used to treat Zollinger-Ellison syndrome, a syndrome characterized by hypersecretion of gastric acid and the formation of peptic ulcers. The client diagnosed with type 2 diabetes is prescribed the medication glipizide. Which statement by the client warrants intervention by the nurse? 1. I have to eat my diabetic diet even if I am taking this medication. 2. I will need to check my blood glucose level at least once a day. 3. I usually have 1 glass of wine with my evening meal. 4. I do not like to walk every day, but I will if it will help my diabetes. The correct answer is 3. I usually have 1 glass of wine with my evening meal. Glipizide is a sulfonylurea which stimulates the pancreatitis to secrete more insulin. Sulfonylureas and biguanides may cause an antabuse-like reaction when taken with alcohol, causing the client to become nauseated and vomit. Advise the client to abstain from alcohol and to avoid liquid over-the-counter medications that may contain alcohol. Alcohol also increases the half-life of the medication and can cause a hypoglycemic reaction. The client with type 2 diabetes does not need to walk daily to keep the glucose level within normal limits. Walking 3 times a week will help control stress and help decrease weight if the client is overweight. The client with type 2 diabetes must adhere to the prescribed diet to help keep the blood glucose level within the normal range. Delaying or missing a meal can cause hypoglycemia. The statement in option 1 would not warrant intervention by the nurse. The client should check blood glucose levels to determine if the medication is effective. Therefore, the statement in option 2 would not warrant intervention by the nurse. The home healthcare nurse is caring for a male client diagnosed with a hiatal hernia and reflux. Which data indicates the medication therapy is effective? 1. The client takes the antacid 1 hour before and 3 hours after a meal. 2. The client reports indigestion after eating a large meal. 3. The client states that he did not wake up with heartburn during the night. 4. The client has lost 3 pounds in the past 2 weeks. The correct answer is 3. The client states that he did not wake up with heartburn during the night. Option 3 indicates an improvement in symptoms and that the medication is effective. Option 1 indicates client compliance with the dosing regimen for antacids, not that the medication is effective. The return of symptoms in Option 2 indicates the medication is not effective. In Option 4, losing weight would not indicate that a medication for hiatal hernia is effective. Which statement best describes the pharmacodynamics of insulin? 1. Insulin causes the pancreas to secrete glucose into the bloodstream. 2. Insulin is metabolized by the liver and muscle and excreted in the urine. 3. Insulin is needed to maintain colloidal osmotic pressure in the bloodstream. 4. Insulin lowers blood glucose by promoting the use of glucose in the body cells. The correct answer is 4. Insulin lowers blood glucose by promoting use of glucose in the body cells. The statement in Option 4 explains the pharmacodynamics, which is the drug's mechanism of action or way that insulin is utilized by the body. Over time, elevated glucose levels in the bloodstream can cause long-term complications, including nephropathy, retinopathy, and neuropathy. Insulin lowers blood glucose by promoting the use of glucose in body cells. The pancreas does not secrete glucose. It secretes insulin, which is the key that opens the door to allow glucose to enter the body cells. Glucose enters the body through the gastrointestinal system. The statement in Option 2 explains the pharmacokinetics of insulin and how the body metabolizes it and excretes it in urine. Pharmacokinetics is the process of drug movement to achieve drug interaction. Insulin does not maintain colloidal osmotic pressure. Albumin, a product of protein, maintains colloidal osmotic pressure. The nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. 1. Order an infusion pump for the client. 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. 4. Check for allergies to cephalosporin. 5. Ask the client his or her date of birth. The correct answers are 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. And 5. Ask the client his or her date of birth. The head of the bed is elevated for the client to be able to swallow the medication. The nurse must check the medication administration record with the client's ID band to ensure the correct client is receiving the medication. The Joint Commission requires that 2 patient identifiers be used to determine the right patient. Most healthcare facilities use the client's name and date of birth as these identifiers. An IV pump is not needed. Esomeprazole is a PPI, not a cephalosporin. Cephalosporins are a class of antibiotics. The nurse is discussing storage of insulin vials with the client. Which statement indicates the client understands the teaching concerning the storage of insulin? 1. I will keep my unopened vials of insulin in the refrigerator. 2. I can keep my insulin in the trunk of my car, so I will have it at all times. 3. It is all right to put my unopened insulin vials in the freezer. 4. If I pre-fill my insulin syringes, I must use them within 1 to 2 days. The correct answer is 1. I will keep my unopened vials of insulin in the refrigerator. This statement indicates the client understands the medication teaching. Keeping the insulin in the refrigerator will maintain the insulin's strength and potency. Once the insulin vial is opened, it may be kept at room temperature for 1 month. Insulin vials should not be placed in direct sunlight or in a high-temperature area, such as the trunk of a car, because it will lose its strength. Insulin should not be kept in the freezer because freezing will cause the insulin to break down and lose its effectiveness. Pre-filled syringes should be stored in the refrigerator and should be used within 1 to 2 weeks, not 1 to 2 days. The nurse is discharging a client diagnosed with gastroesophageal reflux disease. Which information should the nurse include in the teaching? 1. There are no complications of gastroesophageal reflux disease as long as you take the medications. 2. Notify the HCP if the medication does not resolve the symptoms. 3. Immediately after a meal, lie down for at least 45 minutes. 4. If any discomfort is noted, take an NSAID for the pain. The correct answer is 2. Notify the HCP if the medication does not resolve the symptoms. There may be several complications of gastroesophageal reflux disease. Adult-onset asthma and Barrett's esophagus leading to cancer of the esophagus are two complications of gastroesophageal reflux disease. The chance of developing these problems is less if the GERD is adequately treated, but there are no guarantees. The client should be instructed to sit upright for at least 60 minutes following a meal to prevent reflux from occurring. NSAIDs can increase gastric distress. Ulcers caused by NSAIDs use may be asymptomatic, or the symptoms may be attributed to the GERD. The client should use the prescribed H2 receptor blocker, PPI, or an antacid to relieve the discomfort associated with gastroesophageal reflux disease. Which assessment data best indicates the client with type 1 diabetes is adhering to the medical treatment regimen? 1. The client's fasting blood glucose is 100 mg per deciliter. 2. The client's urine specimen has no ketones. 3. The client's glycosylated hemoglobin is 5.8%. 4. The client's glucometer reading is 120 mg per deciliter. The correct answer is 3. The client's glycosylated hemoglobin is 5.8%. A glycosylated hemoglobin gives the average of the blood glucose level over the past 3 months and indicates adherence to the medical treatment regimen. A glycosylated hemoglobin level of 5.8% is close to normal and indicates that the client is adhering to the treatment regimen. The fasting blood glucose level is obtained after the client is NPO for 8 hours. This blood result does not indicate adherence to the treatment regimen. If the client has no ketones in the urine, it indicates that the body is not breaking down fat for energy, but it does not indicate adherence to the treatment regimen. A glucometer reading of 120 mg per deciliter indicates a normal blood glucose level, but it is a one-time reading and does not indicate adherence to the medical treatment regimen. The adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? 1. Omeprazole daily. 2. Amoxicillin twice daily. 3. Loratadine daily. 4. Prednisone daily. The correct answer is 1. Omeprazole daily. Omeprazole is a PPI. Up to 90% of adult-onset asthma is the result of gastroesophageal reflux disease. Treating gastric reflux will treat asthma. Amoxicillin is a penicillin-derived antibiotic. The client is diagnosed with asthma, not an infection. There is no reason to administer an antibiotic. Loratadine is an antihistamine. Antihistamines such as Claritin are used to treat allergic reactions to pollens, dust, or other irritating substances. They are not effective against asthma. Prednisone is a glucocorticoid. Glucocorticoids are prescribed daily for clients with chronic lung diseases, such as emphysema or chronic bronchitis. A client with asthma would not be prescribed a daily steroid. The nurse in the medical department is preparing to administer insulin Lispro to a client diagnosed with type 1 diabetes. Which intervention should the nurse implement? 1. Ensure the client is wearing a Medic Alert bracelet. 2. Administer the dose according to the regular insulin sliding scale. 3. Assess the client for hyperosmolar, hyperglycemic, non-ketotic coma. 4. Make sure the client eats the food on the meal tray that is at the bedside. The correct answer is 4. Make sure the client eats the food on the meal tray that is at the bedside. Insulin Lispro peaks in 30 minutes to 1 hour. Therefore, the client needs to eat when or shortly after the medication is administered to prevent hypoglycemia. Because the client is in the hospital, the client must have a hospital identification band. A Medic Alert bracelet would be needed when the client is not in the hospital. Insulin Lispro is not regular insulin, it is fast-acting insulin. It is not administered according to the regular insulin sliding scale. The peak time for insulin Lispro is 30 minutes to 1 hour. Regular insulin peaks in 2 to 4 hours. A client with type 1 diabetes will experience DKA. A client with type 2 diabetes will experience hyperosmolar, hyperglycemic, non-ketotic coma. The client diagnosed with ulcerative colitis is prescribed mesalamine. Which information should the nurse discuss with the client? 1. Explain to the client that undissolved tablets may be expelled in stool. 2. Discuss the importance of taking the medication on an empty stomach only. 3. Tell the client to avoid drinking any type of carbonated beverages. 4. Instruct the client not to crush, break, or chew the tablets or capsules. The correct answer is 4. Instruct the client not to crush, break, or chew the tablets or capsules. Mesalamine is an aspirin derivative. The tablets must be swallowed whole because they are specially formulated to release the medication after it has passed through the stomach. The client should notify the HCP if undissolved tablets or capsules are found in the stool because this is not expected. This medication can be taken with or without food. Food does not affect the effectiveness of the medication. There are no restrictions on foods, beverages, or activities when taking this medication unless the HCP directs otherwise. The client newly diagnosed with type 1 diabetes asks the nurse, "Why should I get an external portable insulin pump?" Which statement is the nurse's best response? 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. 2. Insulin pumps provide an automatic memory of the date and time of the last 24 boluses. 3. The pump injects intermediate-acting insulin automatically into the vein to maintain a normal blood glucose level. 4. The portable pump is the easiest way to administer insulin to someone with type 1 diabetes and is highly recommended. The correct answer is 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. A portable insulin pump is a battery-operated device that uses rapid-acting insulin, Lispro, Humalog, or Novolog. It delivers continuous release of a small amount of insulin and bolus doses with meals. This provides fewer hypoglycemic reactions and better blood glucose levels. The pumps do provide a memory of boluses, but that is not the nurse's best response to explain why a client should get an external portable insulin pump. External portable insulin pumps are only used to deliver rapid-acting insulin subcutaneously. Intermediate and long-acting insulins are not used with an external portable insulin pump because of unpredictable control of blood glucose. The insulin pump is not recommended as the initial way to administer insulin because the success of the insulin pump depends on the client's knowledge and compliance. Initially, most clients start injecting insulin with a syringe and then graduate to the pumps. The client diagnosed with inflammatory bowel disease is prescribed sulfasalazine. Which intervention should the nurse implement when administering this medication? 1. Ensure the client drinks at least 2,000 milliliters of water daily. 2. Administer the medication once a day with breakfast. 3. Explain that the medication may cause slight bruising. 4. Assess the client's stool for steatorrhea and mucus. The correct answer is 1. Ensure the client drinks at least 2,000 milliliters of water daily. Sulfasalazine is a sulfonamide antibiotic. Increasing fluid intake dilutes the drug, which helps to prevent crystalluria from occurring. The medication is administered every 6 to 8 hours, not once a day. Instruct the client to report any bruising or bleeding because it could be a sign of a drug-induced blood disorder. This medication will not cause fat, frothy stools. Therefore, the nurse does not need to assess the stool. The client diagnosed with type 1 diabetes is reporting a dry mouth, extreme thirst, and increased urination. Which interventions should the nurse implement? Select all that apply. 1. Administer 1 amp of IV 50% glucose. 2. Prepare to administer IV regular insulin. 3. Inject insulin isophane subcutaneously in the abdomen. 4. Hang an IV infusion of D5W at a keep open rate. 5. Check the client's blood glucose level via a glucometer. The correct answers are 2. prepare to administer IV regular insulin. And 5. Check the client's blood glucose level via a glucometer. The client's signs and symptoms indicate the client is experiencing diabetic ketoacidosis, which is treated with IV regular insulin. These are signs, symptoms of DKA. Therefore, checking the client's blood glucose level is an appropriate intervention. 1 amp of 50% glucose would be used to treat a severe hypoglycemic reaction, and this client does not have signs or symptoms that indicate hypoglycemia. In fact, the client has signs and symptoms of hyperglycemia. Insulin asaphane is an intermediate-acting insulin, which is not used to treat hyperglycemia. An IV of D5W would cause the client to have further signs and symptoms of DKA. Therefore, the nurse should not administer the IV. The client diagnosed with severe ulcerative colitis is prescribed azathioprine. Which assessment data concerning the medication warrants immediate intervention by the nurse? 1. Reports of a sore throat, fever, and chills. 2. Reports of 10 to 20 loose stools a day. 3. Reports of abdominal pain and tenderness. 4. Reports of dry mouth and oral mucosa. The correct answer is 1. Reports of a sore throat, fever, and chills. Azathioprine is an immunosuppressant and can cause a decrease in the number of blood cells in the bone marrow. Signs or symptoms that would warrant intervention by the nurse include sore throat, fever, chills, unusual bleeding or bruising, pale skin, headache, confusion, tachycardia, insomnia, and shortness of breath. 10 to 20 loose, watery stools a day are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Abdominal pain and tenderness are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Dehydration may occur with ulcerative colitis, but it does not warrant intervention by the nurse secondary to the medication. The nurse administered 12 units of regular insulin to the patient with type 1 diabetes at 0700 hour. Which meal prevents the client from experiencing hypoglycemia? 1. Breakfast. 2. Lunch. 3. Supper. 4. Nighttime snack. The correct answer is 1. Breakfast. Regular insulin peaks in 2 to 4 hours. Therefore, the breakfast meal would prevent the client from developing hypoglycemia. Lunch would cover an 0700-hour dose of insulin asaphane, an intermediate-acting insulin. Supper would cover a 1600-hour dose of regular insulin, a short-acting insulin. The nighttime snack would cover a 1600-hour dose of insulin asaphane, an intermediate-acting insulin. The client diagnosed with a severe acute exacerbation of Crohn's disease is prescribed total parenteral nutrition, TPN. Which interventions should the nurse implement when administering TPN? Select all that apply. 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. 3. Assess the peripheral IV site every 4 hours. 4. Check the TPN according to the 6 rights prior to administering. 5. Encourage the client to eat all of the food offered at meals. The correct answers are 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. And 4. Check the TPN according to the 6 rights prior to administering. TPN is 50% dextrose. Therefore, the client's blood glucose level should be checked every 6 hours. Sliding scale regular insulin coverage is usually ordered. TPN should always be administered using an IV pump and not via gravity. Fluid volume resulting from an overload of TPN could cause a life-threatening hyperglycemic crisis. TPN must be administered via a subclavian line because a peripheral line will collapse as a result of the hyperosmolarity of the TPN and phlebitis may occur. The client with severe acute exacerbation of Crohn's is NPO to rest the bowel. When on TPN, the client is usually NPO because the TPN provides all necessary nutrients. Therefore, the nurse would not encourage the client to eat food. The nurse is teaching a client with newly diagnosed type 1 diabetes about insulin therapy. Which statements indicate the client needs more teaching concerning insulin therapy? select all that apply. 1. If I have a headache or start getting nervous, I will drink some orange juice. 2. If I pass out at home, a family member should give me a glucagon injection. 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. 4. I will check my blood glucose with my glucometer at least once a day. 5. I should administer my insulin in my abdomen for best absorption. The correct answer is 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. Even with insulin therapy, the client should adhere to the American Diabetic Association diet, which recommends carbohydrate counting. The statement in option 3 indicates the client needs more teaching. Headache, nervousness, sweating, tremors, and rapid pulse are signs of a hypoglycemic reaction and should be treated with a simple acting carbohydrate, such as orange juice, sugar-containing drinks, and hard candy. If a client cannot drink or eat a simple carbohydrate for hypoglycemia, then the client should receive a glucagon injection to treat the hypoglycemic reaction. Monitoring and documenting the blood glucose level is encouraged to determine the effectiveness of the treatment regimen. The abdominal area best absorbs insulin. Therefore, the client does not need more teaching. The client diagnosed with inflammatory bowel disease, taking mesalamine reports, nausea, vomiting, and diarrhea. Which intervention should the clinic nurse take? 1. Instruct the client to quit taking the medication immediately. 2. Tell the client to take lansoprazole with the medication. 3. Advise the client to keep taking the medication, but notify the HCP. 4. Explain that these symptoms are expected and will resolve with time. The correct answer is 3. Advise the client to keep taking the medication, but notify the HCP. Mesalamine is an aspirin derivative. These are side effects of the medication, and the HCP should be notified, but the client should not stop taking the medication. The client should not quit taking the medication abruptly, because that would result in an acute exacerbation of the inflammatory bowel disease. Lansoprazole is a PPI. A PPI will not help treat these symptoms. These symptoms will not resolve with time and should be reported to the HCP.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.